Okay. Hi everyone, I'm Mindy Simmons and I am a student at CCCUA and I'm doing a demonstration speech over CPR for my speech class. So if you don't mind, kind of show the audience.
Okay.
I can't stop.
Okay. And what I'm going to be talking about is cardiopulmonary resuscitation, which we know as CPR. And what I kind of want to talk about is CPR was established in 1960 by the American Heart Association. When victims were being worked on before then, they had no way to bring them back to life when they were unresponsive and pulseless. So they done some studies and research and found that if you can keep the blood moving through the body and oxygenated blood into the brain, then your patient or your victim has a better chance of survival. And if you want, you can just keep that on me.
Okay.
And anyway, sorry. And so what they did is they developed a way to keep that blood moving, and the main thing is compressions. Now, at one time they did 15 compressions and then 2 breaths, and they focused a lot on the airway and the breathing. But what they have discovered since 2005 through research, and what they did is they collected data from other countries along with the United States, and they saw that our mortality rate was worse than they wanted with CPR. So they did these other studies, they collected a lot of data from other countries to see what they were doing, and they have found that more compressions actually keeps more oxygenated blood to the brain, which gives your patient or victim a stronger chance of survival. So what I'm going to kind of demonstrate is basic CPR, and anyway, maybe you'll get something out of this. But when you come up on someone, if they are pulseless and unresponsive and not breathing, first you want to check and ask them, are you okay, are you okay? If they do not respond, you'll want to do what they call look, listen, and feel. And you're going to look to see if their chest is rising or not. You're going to be listening for their airway and feeling to see if there's any air hitting your cheek. If there is not, or go ahead and take their pulse and use 2 fingers and you place that on the neck, and you'll be able to feel if there's a pulse in there. If there is not, you want to come down here and start compressions. And to do that, you go by the rib cage and just use your fingers to follow the rib cage up to the sternum. And right here at the sternum, there's a little nodule, and it's called the xiphoid process. And you'll want to go about 1 inch or 2 above that, or you can kind of judge between the nipples. 2 is a good way. But go a couple of inches above that, place one hand and interlock the other, and you're going to want to do 30 compressions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then you're going to want to come down and give 2 breaths. And with each breath, you're going to be watching to make sure that the chest rises and falls. You want it to rise and fall about 1/2 inch. But anyway, then you'll come back. You'll do 30 more compressions. I'm not going to do that, but that's how you'll do it. You'll do 30 more compressions, and then you come back and you give 2 breaths. Then you'll do 30 more compressions, 2 breaths. 30 more compressions, 2 breaths. And then you're going to check for a pulse. So you'll do 4 cycles. That's called a cycle when you do 4 of each. And then if there's still no pulse, you will start again. You're going to do this until help arrives or you are completely exhausted. And then hopefully you can get your patient or victim to the nearest hospital where they have, of course, more life-saving equipment. But anyway, this is your basic CPR, and I hope you've learned something from it, and I hope that it helps you in everyday life. life if you come across something like this. Is there any questions? Thank you very much.